Hi everyone, I'm Terralon. Welcome to Time Out with Tinseltown Mom. Today I'm going to be speaking with two moms, Carri, Levy, and Molly Major, who created a rare disease medical series called Behind the Mystery, Rare and Genetic, a recurring series on the award-winning show The Balancing Act that airs on Lifetime TV. Today we're going to be talking about how they were inspired to create this show over 8 years ago. Plus, with Rare Disease Day coming up on February 29th, they're going to talk about the launch of their new digital education campaign. Hi, Molly and Carri. Welcome to the show.
Thank you.
Hi. Thanks for having us.
Well, thanks for being on. I'm excited about this episode for personal reasons, too, because I think I have a rare disorder that we can talk about.
Now I have to know everything about what's wrong with you so I can diagnose you.
I know, all right? Wait, before we talk about that, I was going to ask you, ladies, do you have any sort of medical background, like either one of you?
We do not.
Okay.
So Carri is the mom of a daughter who has a rare disease, and you'll find that the parents are really the drivers behind rare and genetic disease education because there's so little known about some of these ultra orphan conditions that it's the parents that are doing all of the research and starting their own biotechs, in this space. So Carri has learned so much over the past, how many years now, Carri?
Too many years. My daughter's 30. She's been sick all of her life.
Wow.
Yeah, so she was diagnosed with one disease when she was 19 that was on a newborn screening that she didn't have. And then she was diagnosed with another disease, and then she still has one more. Hopefully it's just one more that we just don't know what it is. So yeah, it's a definitely, you learn a lot of stuff that you don't really want to learn about.
Yeah, so you're saying starting at age 19 is when you first realized she had this
No. We always knew she was sick. She'd been sick all her life.
Yeah.
But we just, doctors were telling us, there's nothing wrong with her, or that's normal, or it's just don't worry about it, or that kind of thing. And she had ended up being diagnosed with a disease called primary immune deficiency disease, which is kind of like the boy in the bubble, but not as bad. But her immune system wasn't able to fight off anything, and she was always getting sick all of her life. And I just kept saying, there's something wrong. She's just always sick, and she's got this, and she's got that, and she's got this. And the doctor's like, don't worry about it. Don't worry about it. Until she was literally she had lost so much weight. She was coughing for a year. And we brought her, finally, somebody told me about a doctor, and we brought her to this doctor's office, and I carried her in there. And he looked at her and he says, I think I know what she has. And he took some tests, and we came back a couple of days later, and he put her immediately into the hospital to get IVIG, which is immunoglobulin therapy, because our immune system wasn't able to fight off viruses and infections. So it was just it was such an easy thing if you know what to look for. And no doctor looked for it. And so we didn't know anything about it.
Wait, and how old was she when she first started having any sort of symptoms of sickness?
She was always sick her whole life.
She was a baby. From when she was a baby, she started
she always had problems with her stomach. If she wasn't in the hospital for problems with asthma or pneumonia, she was in the hospital for problems with her stomach, which we didn't know what was wrong with her stomach. It turned out she had an exploratory surgery after she got that primary immune deficiency disease diagnosis. She just having horrible stomach pain, and she had just horrible stomach pain. And the doctors kept saying, there's nothing wrong with her. There's nothing wrong with her. And I finally had my gynecologist do an exploratory laparoscopy on her because my sister and I both have endometriosis. And I said, please, I don't know what's wrong with her. Nobody can help me. And she's in excruciating pain. And he went in and he came out hours later, and he said, I've never seen anything like this before. All of her organs were wrapped up in adhesions and pulled to one side. And once he released it, she was able to eat. Eating was like eating glass, she said. And so that was just another part of the journey. It was, it's crazy what goes on in the world. So we don't even know what that's all about.
Yeah, that's so amazing, though, that you've just been an advocate, though, for your daughter. But going back before that, let's start by just getting to know you two a little bit. How do you guys know each other?
Go ahead, Mom.
So, yeah. So Carri and I are obviously senior producers for the Balancing Act. I've been with the program for the past, this is my 11th year. This is Carri's 15th year working on and producing the Balancing Act. And we've spent the greater part of our career with the program focusing on health-related conditions. So, covering anything from colon cancer and the importance of early detection and routine screening to knee osteoarthritis and treatment options to back to school, vision testing and really everything in between. And we sat next to each other for the longest time. Our offices were right next door. And Carri's daughter was going through, a lot of, painful hospitalizations at the same time as my brother, twin brother, was diagnosed with acinar cell cyst adenoma, which is an extremely rare pancreatic tumor. And so we spoke one day about both of these conditions affecting both of our families, and decided, we've got this national television show. We need to really reach out to women and educate them about what rare diseases are and the journeys that we're going through, to really create awareness on a national level, because in the rare space, these diseases may be small in and of themselves, but the reality is that 30 million Americans are living with rare diseases. That's 1 in 10 people. So as a whole, it's really big. So we really wanted to make an impact, and again, use our platform to share with the world, more about what these diseases are, who they're affecting, what the diagnostic journey is, and really give a voice to these patients affected.
Yeah. So you both knew each other when your loved ones were going through these these journeys of health, right, these health issues. And then you came together. Like, how did you think about having a show that talked about rare diseases? Like, how did that transpire?
I put all of my daughter Alana's symptoms into Google, and I found the National Organization for Rare Diseases, and I saw that there were over 7,000 rare diseases. And so, we talked about it. And so we pitched a 6-part series to our executive board in order to create these segments on rare diseases. And that's how we did it.
That's interesting. Yeah, it's interesting that you mentioned that you Googled your symptoms, because that's what I did for mine. Yeah. So
hopefully some of our segments have come up on YouTube for you when you Google them.
I have a cerebral spinal fluid leak. So the reason why I even knew I had this is because my sister, I mean, it's so rare. My sister, a healthy young woman 9 years ago, she actually was diagnosed with this, but it took them years to figure out what was going on with her, because the doctors didn't believe that a healthy woman would just have this spontaneous leak, like with no trauma or anything.
Was it coming out of your nose?
It wasn't coming out of her nose, but they did determine that she had a leak, but her doctors could not find the leak. So she was an advocate for herself. Like, they finally told her there's nothing more we can do. Like, she had 2 small kids. She took it upon herself to find this world-renowned doctor at Cedars-Sinai. She reached out to him. And from her MRI, he was able to spot the leak on her MRI and said, I think I see something in T4. So she took it back to her doctors, and lo and behold, that's where the leak was coming from. I mean, she literally had to take off of work for over a year. Like, the only relief was laying on her back to relieve the headaches. So fast forward 9 years later, I started having similar symptoms. And she was like, you know what? You should try laying on your back to see if that helps. And lo and behold, that worked for me. So I was able to go to my neurologist and say, I think I'm having this. And thankfully my doctors were judicious in my treatments, and they believe me. But it's something that, just like how you mentioned, a lot of times doctors, they misdiagnose, or they're not sure, what's going on with someone. So you really do have to be an advocate for yourself, or you could be living with pain or symptoms for years, and, you never get to the bottom of it.
So what's the treatment for that?
So I have to have an epidural blood patch in 2 weeks, and that will hopefully seal up the leak. So they're pretty sure they know where the leak's coming from just based on my MRIs, and that should take care of the problem. But yeah, so my journey's only been like 7 months of these headaches, but some people, like for my sister, it was like years. Like she was having her symptoms were a lot worse actually than mine. I mean, they caught mine early, so.
I wonder if there's a genetic component to that. If you and your sister
Yes, that's what we were thinking, that there may be some sort of genetic component because they were both spontaneous. Like neither one of us had any trauma. That's exactly what we were thinking.
So have you heard of NORD, the National Organization for Rare Diseases, or Global Genes?
I have not.
Okay, so here's what I would say to you and to your listeners. If you have something that's familial and something like this, where your sister and you both have had the same symptoms, and thank God you both, were able to get help for it. But Google cerebral leaks. Google anything else that you feel would be something that your sister and both of you have, like in your medical history. Put it all together.
Yeah.
And then Google all of that, or look on NORD, the National Organization for Rare Diseases, nord.org. Like I said, there are over 7,000 rare diseases. They have a lot of them on the website, but you might be able to find not only a group of people that have this, but also be able to see what else, maybe in your future, what else are people doing in order to, to stay healthy with this, or to, make sure that this doesn't happen again. Or maybe there's some studies going on, or maybe there's a genetic test that you can have so that, if you're getting pregnant or you're having children, or your children can have that test as well to know what's coming up. So, there's small groups out there. There's ultra orphan rare diseases. Like Molly said, her brother has a very, very rare disease. Turns out that my son-in-law has, her brother has this acinar cell
cystadenoma, and
it's a cyst on his. It was a cyst on his pancreas. My son-in-law has acinar cell carcinoma of the pancreas.
Oh.
So yes, the cancer.
One is benign and one is malignant.
Oh,
yes.
Wow.
So, but just the more people that talk about what they have or what their family has, the more people that can get together and they can start working on it so that their children and their children's children can have treatment and a cure. So that's what we're doing with the show. We're trying to find people that have these diseases, let them know what the signs and symptoms are, what the specific tests that you have, that you need in order to get diagnosed, but also if there's a foundation that's available already, or how to get involved with foundations, or how to start your own foundation so that you can start getting research done on your disease. Because if it's affecting you and it's affecting your sister, most likely it's going to affect your children.
Yeah, absolutely. No, that's great information. So going back to your show though, so is that what you do on your show? Like you take real life cases and you just go through their journey with them, and hopefully, okay. How many rare disease segments do you think you've done in the 8 years, right? 8 years you've been doing this?
Yeah, we've done over 86 segments so far. And
wow.
This year we have 16 of them in alignment now for production. So.
Wow. Have you done any on cerebral spinal fluid leak? Like, is that something that even has come up?
No, we haven't, but I'm pretty sure that that's part of something else. I'm sure that's not the only thing that is the symptom.
Yeah, especially definitely for my sister, because she's having some other symptoms with that. So no, I'm gonna take your advice and look into that further, actually.
Yeah, and have her call me, and I'm happy to speak with her and learn more about it and see if I can point you both in the right direction of where to go.
Oh, thank you so much. So going back to your show, what is some positive feedback that's come out of like some of the cases that you've worked on the show?
We get the feedback from the people that we work with, and we generally work with pharmaceutical companies and biotech companies because they're the ones that are really helping raise awareness about these diseases. So the people that we've worked with tell other people in different companies that the patients have found them through finding our segments and getting to them through our website. So that's great. I mean, that's what we're looking to do. We're looking to find patients on these very, very rare diseases and hook them up with the right people so that they can get into clinical trials or they can get part of foundations. We've had some really nice feedback from the different people that we've worked with in the past.
Yeah. And I'm sure just delving deeper into some of these rare diseases, it's helped people who are going through similar situations to figure out what's going on with them. Like, have you heard any stories like that of people who have actually been able to diagnose their symptoms and get treatment after one of your episodes?
We've heard it in like a year later.
Oh,
yeah, because our programming lives on the internet.
right.
It airs on Lifetime TV. We're in syndication, throughout the country. We're in hotel rooms. But once it goes onto YouTube, it's there forever. So, people, when like yourself, when you have symptoms, you just went to Google and you started Googling. If we had done a segment on what you have, it would have come up.
Right.
Because there's not a lot of information about these rare diseases out there. So our stuff comes up. So I encourage your listeners, if they have anything wrong with them, to just go to thebalancingact.com and look under Behind the Mystery and just start looking at these segments, because they're eye-opening.
Right. Right. Now, speaking of Google, though, because I know many people Google their symptoms when they can't get relief or just in general. And there's different schools of thought on that as far as if you should Google your symptoms, because you never know what you're going to find. Like, do you recommend people to Google their symptoms?
Listen, I recommend that people take control of their health care and their family's health care. I think that doctors are practicing, and that's great. But, at the end of the day, you're responsible for your health. Yeah. And if you think that there's something wrong with your child, like I did, I knew there was something wrong with her. I knew that the doctors weren't getting to the bottom of it. I was sick of being told that there's nothing wrong with her, that it's all in her head, that, she just has anxiety, that, things like that, when she actually had tachycardia. And that's why her heart was racing so fast. I'm a big believer in a mother's intuition, or, and being able to, if you know something's wrong, to Google. To just keep looking, keep searching, talk to people about it, get your information out there, and you will find somebody that has information. Just keep asking.
Right. Yeah. You said it best. I mean, you have to advocate for yourself and, your loved one, because in the rare world, it takes 4.8 years on average for a patient to receive an accurate diagnosis. So that's quite a long journey.
Yeah. Wow. And my daughter was 19 years, so that was a really long journey.
Wow. And Molly, your twin brother, right? He's the one that had a rare disease. Okay, what's going on with him now in his treatment? Is he getting the right treatment now?
Yes. So actually, at the time of his diagnosis, let me kind of back up. So Carri explained that, acinar cell adenoma is an extremely rare pancreatic tumor. And at the time of his diagnosis, there were only 12 previously reported cases. So a pancreatic tumor in and of itself is a jarring diagnosis, but imagine being like one of, only 12 other cases. That in and of itself was so disconcerting. But the good news out of all of this was that he found, or our family was able to find a surgeon who specialized in pancreatic tumors and resection at Thomas Jefferson University in Philadelphia. So he flew from Chicago to Philadelphia, had a Whipple procedure, which was a really long recovery. And it's basically like a resection. They took out some of his intestine and obviously the tumor. So he only has a small part of his pancreas left, but he's doing really well now. And, successful in his job, and, seems to be, on a good path, really health-wise. So
that's great outcome. Yeah. So that's great that you had one another, though, when your loved ones were going through their health journeys. Even through horrible circumstances, like, you can find something good to produce from it, which your show has done, because I'm sure it's helping thousands of people get some sort of relief or get some answers that they would never have gotten had you not come up with such a great idea to have a show like this.
And also find, support groups and other people, living with conditions that, they themselves are living with. It's good to know that there's others out there that you can lean on and talk to for that, support that you really need going through a journey like this.
Right. Now, what would you say to someone who maybe they're having some symptoms and maybe they're not getting answers? How do you recommend someone advocate for themselves and it not turn into like hypochondria, for example? Do you know what I mean? Like, sometimes people, like, there's a fine line sometimes, like, especially when you're continuously reaching out to your doctor. Like, do you have any suggestions as far as that's concerned?
I'm I'm all about the Google. Like people like it's funny because I honestly, my daughter kept saying to me, Mom, you need to get tested. You need to get tested, because I was always sick also. And that's, I think I was such an advocate for my daughter, because I knew I was sick throughout my life. I always had, something wrong with me. And finally, about 2 years ago, I also had a cough that would not go away. And she's like, you need to get tested. She like demanded it of me. And I finally got tested, and I ended up having, CVID, which is part of primary immune deficiency disease, but it's combined immunodeficiency disease. So it was the same kind of disease that she had, where my immune system wasn't working. Oh. But I had it all my life, and I just just never did anything about it until my daughter insisted. So I would say, just like you and your sister, you knew something was wrong with you. I don't think that people, I think that people know when something's really wrong with them.
Yeah. Yeah.
I don't believe in hypochondria. I really don't. I believe that if there's something wrong with you, then, keep looking, because there's, like I said, over 7,000 rare diseases out there.
Yeah. I'm of that mindset too. I mean, I always think about, as a mother, you think about wanting to be healthy for your kids. To me, if you have to reach out to your doctor on a continuous basis because you know that something's not right with your body, I'm of the mindset to keep reaching out until you can find the answer, keep doing what you need to do until you can get a resolve with your particular scenario. So that's my feeling of it.
Yeah, absolutely. And I think it's interesting. My daughter grew up with, I wasn't a big believer in doctors. I wasn't a big believer in medication. She had to take a lot of antibiotics when she was little because she had multiple ear infections, because of course I didn't know she had an immune deficiency. But I always had her go to the chiropractor and do acupuncture and energy work, and, tried all different kinds of diets on her, and nothing was working. So when she turned 18, she just started going straight to the doctors and started really investigating, what was wrong with her, because she was sick of doing, she said, Mom, it's great that, you can have a healthy diet, but that's not going to cure a genetic disease. And, she really had to open my eyes up to, what real disease was. And as much as I, can eat sprouts all day long, which I do, there's still times when you're going to need to really take control of your healthcare and see a doctor and get tested and find out what's really wrong with you.
Right. Now, did you say that there was a genetic connection between you and your daughter, Carri?
Yeah. Yeah.
Okay. So so did you have to have other family members get tested for this?
We haven't. I have a daughter that's older than my younger daughter Alana that's sick. She's got some stuff going on, but she hasn't had genetic testing yet.
Just going back to the genetic, I mean, in my family, my uncle actually had thyroid cancer. It ended up being a very rare genetic type of cancer called MENS2. He actually ended up passing away. But because of what he had and what the doctors discovered, all of our family members had to get tested for this rare genetic disorder. Because if you did have this rare genetic disorder, you had to get your thyroid removed or it would definitely turn into cancer. So my sister ended up having this, my mother, my younger sister had it, a lot of other family members had it. And if you have it, then you could pass it on to your child. Thankfully, I did not have it, but because of my uncle and his diagnosis, we were able to get the whole family tested on this because of this rare genetic type of thyroid cancer he had. And he actually saved a lot of our lives because of it. And I think
that's awesome.
Yeah.
That's awesome.
So, I mean, there's something to be said about the genetic testing in diseases. And if you feel like there's some sort of genetic connection, getting that tested just to ensure that, other family members are not unnecessarily going through heartache, they don't need to. So again.
And also Huntington's disease. I mean, there's a whole group of, children who have formed an alliance to help people that are, whose parents have Huntington's disease, because that's a devastating disease. But if you are, a lot of people don't want to take the test and know about it and know what their future is going to be like.
Yeah.
But, a lot of people are brave and they take the test and they find out if they have the gene, and then they deal with life. They have to deal with, what life is going to bring them. But I think that, and they're involved in research and clinical trials and developing them. So I think that, even if there's no treatment, like there's a treatment for your uncle's disease, to removing the thyroid, there are a lot of diseases where, I don't know. I'm a proponent of knowing.
Yeah.
So.
Some people are the opposite. They're the proponent of not knowing and they never go to the doctor. So there's that group of people too.
Yeah.
Now, just going back, Carri, to your daughter, how is she doing today?
She's, she's chronically ill. She's got a book called Surviving and Thriving with an Invisible Chronic Illness. So she's created her life as an advocate. She works full time in the world of rare diseases and chronic illness, and she's married. And right now she's on the road to trying to have a baby. So she's going down that path, and she's an incredibly spectacular woman, and I'm really, really proud of her.
That's awesome. So going back to your show, I know you've covered a lot of rare diseases. What do you think, like, one of the rarest diseases that you guys have covered on the show? Like, what can you think of? Any one that stands out in your mind?
Loud deficiency.
What deficiency? What is it called?
Loud deficiency. I want to say that was like the second segment we ever covered. And don't ask me for statistics. I just remember it being very an ultra orphan disease, which means it affects very few people, and it's usually diagnosed at birth. That's the rarest I can think of.
You got a lot of rare ones coming up, though.
Oh, I'm sure. When does your show come on?
We're part of the Balancing Act, so it's the Balancing Act is the morning talk show on Lifetime TV. It's on weekday mornings between 7:30 and 8 on Lifetime.
Okay.
So we usually air. Well, this year we're going to be airing a lot more than we usually air. But the next one will be March. I would say 4th. Molly, when do you know what the date is?
Yes, it's March 4th. So 7:30 a.m.
And you're also on YouTube, though. You can find your shows on YouTube.
Oh, yeah.
Yeah.
Yes. And also, if you go to thebalancingact.com/rare, you can find all of the episodes we've done so far on that landing page.
Okay. And then you have a new digital education campaign that you've just launched. Can you tell us about that?
Sure. So this digital campaign was created to share with our viewers really the reason behind, why we're creating Behind the Mystery Rare and Genetic series. So Carri sharing her story within a series of videos. Her daughter is sharing her story. I'm sharing, obviously, mine along with my brothers. And then a couple other people within our company who produce the Balancing Act, obviously, are sharing their stories too. So it's really giving people an understanding of why it is we do what we do every day for this series, and to create awareness for rare and genetic diseases. And we're doing it this month, February, because Rare Disease Day is celebrated globally on the last day of February each year, which is the most rare day on the calendar.
Oh,
so,
wow.
Yeah. So we're kind of aligning to that and doing our part to really, again, raise awareness, and not only about diseases, but about the issues that patients face, and, giving these people a voice and sharing their stories.
Yeah, I think that's incredible. Thank you so much, ladies, for being on the show and just giving us more insight into how to be advocates for ourselves. Is there anything else maybe that we're missing that we could just help people with? Any other tips that you can think of?
I just think the most important thing is just, if you know something's wrong, keep looking.
Thanks for listening to Time Out with Tinseltown Mom. If you liked what you heard today, please be so kind and rate, review, and subscribe on iTunes or wherever you listen to podcasts. Until next time.